Good morning, everyone.
Morning.
My name is Jim Mercy, and I'm the Acting Director of the Division of Violence Prevention at CDC. Patrick and Fran evoked many of the events that have occurred recently and continue to occur over time. This past couple months has been typical in the United States and the world, right? We've had police killings in Ferguson, in the Bronx, Cleveland, and probably other places as well. In Mexico, there's been 43 college students that were abducted and presumably killed. Patrick mentioned Peshawar, where 143 people, mostly kids, were killed in a school as a result of extreme violence. I know just south of here in Fairfax County, there's parents and school administrations concerned that there may be an epidemic of suicide in the high schools. And it goes on and on. In fact, on a typical day in the world, there's 4,000 violent deaths, 26,000 violent deaths in an average week, 120,000 violent deaths in an average month. And this includes war-related deaths, homicides, and suicides. Even if you take out war-related deaths, there's still 3,600 violent deaths on the average day in the world. This means that every 2 days, more people die from violence than have died during the entire Ebola epidemic since its inception. I'm not suggesting that the Ebola epidemic, please, I'm not suggesting it's not serious, does not deserve the resources and the attention and the mobilization that it has received. It absolutely does. It's devastated countries in West Africa. What I am suggesting is that, and asking, is why don't we take the same urgency in addressing violence, particularly lethal violence? Well, one answer is because Ebola is an epidemic, right? And violence has epidemic features, but I think it's largely endemic. In a sense, it's part of our culture. It's part of the air we breathe. Each day in the United States, 10, 15 young black males are killed in our cities. And yet, it's another day in America. Each day, maybe 10, 15 white males, middle-aged white males, kill themselves in suicide. Another day in America. So I've been thinking about how can we evoke the same level of urgency that we give to problems like Ebola, because this problem deserves it. So I ask you to think about that as well. With that as a background, what I'm going to talk about is just a high-level description of the global epidemiology of homicide and suicide as a background for the discussion of the means of violence. I also want to take a little time to discuss lethality as a key issue in the consideration of the means of violence, because a primary reason we're interested in the means is because it contributes, and the choice of means influences the lethality of the violence that occurs. And not just fatalities, although that's what I'll be focusing on, but also the severity of injuries that occur and disabilities associated with violence, spinal cord injuries and traumatic brain injuries. And finally, I want to discuss prevention as it pertains to the means of violence. I think we have more than enough evidence to take action on this issue. And I want to come back to that sense of urgency and the evidence we have and talk about that at the end. Well, I am lucky to have a lot of friends that I called on to help give me the slides that I need to do this presentation. And one source of the slides and information I'll be presenting is the World Health Organization. On December 11th, they released the Global Status Report on Violence Prevention. And this is a very special report because I think what they do in this report is describe the state of the problem of interpersonal violence worldwide, including fatalities, homicide. They document, but just as importantly, they document what countries are doing to prevent and respond to such violence. And they use that information to identify gaps in the global response and hopefully to stimulate action to address those gaps. But this report essentially is a baseline that can be repeated over time to see how much progress is being made in addressing violence, interpersonal violence across the world. Another WHO report that was released in October of this year that I'll be drawing on to a lesser extent is Preventing Suicide, a Global Imperative. This report is sort of different from the Global Status Report, but an overview of the problem of suicide globally, the epidemiology, risk and protective factors, the strategies and prevention approaches used to prevent it, and recommendations for moving forward. Another critically important report for bringing attention to lethal violence. So let's start with homicide. In 2012, there were 475,000 homicides in the world, and you can see the hotspots for homicide. One clear hotspot is Central and tropical Latin America. In fact, the Global Burden Disease Report demonstrated that homicide is the leading cause of years of life lost in Central and Latin America. The leading cause of years of life lost. Not heart disease, not cancer, not all the other things that we think of typically as public health problems, but homicide. In Africa, homicide is the fourth leading cause of years of life lost. So clearly an important public health problem in many areas around the world. You can see that the United States is not among the highest countries when you compare it to other countries around the world. You'll see in a minute when we compare it to other high-income countries, that's a different story. I want to take a second, although my focus is on lethal violence, just to mention that underlying homicide are many different types of non-fatal interpersonal violence. Child maltreatment, violence against women, elder maltreatment, injuries that children suffer. We estimate crudely that each year 1 billion children, half the world's children, are exposed to violence. And that's true in the United States as well, by the way. And also, the other important thing, that deaths and injuries are just a fraction of the burden of violence. We're understanding much better that the adverse experience of being exposed to violence is associated with infectious disease, chronic disease, mental health problems. And I mention these non-fatal aspects because when I show you the suicide deaths, a spoiler alert, there are 800,000 suicide deaths in the world each year, people generally say, oh, suicide is a much bigger problem than interpersonal violence, than homicide. But I want to emphasize that it's not that simple, that exposure to interpersonal violence has other consequences that we often aren't reflected in the mortality statistics, as well as the fact that exposure to interpersonal violence as a child, particularly adverse experiences, is a major risk factor for suicidal behavior. So if we look at homicide rates in the world by age and sex, we can see, and this is a very typical pattern around the world, that these rates peak among 15 and 29-year-olds, then drop off with age, and for males. And you can see that rates among females are much lower. If we look at the United States, if I was to show you the same chart in the United States, it's very similar, except that the homicide rate peaks at a much higher level among young males and drops off much faster with age, but not too dissimilar from the world pattern. Here's data that the WHO gathered on the percent of homicides perpetrated by a firearm by WHO regions. And what they've done is extracted the high-income countries from all these regions, and then on your right side, you can see that they're comparing the high-income countries with the low-income countries from this various regions. AFRO is Africa, AMRO is the Americas, EMRO is the Middle East, Euro is Europe, Southeast Asia, and then Western Pacific. And you can see in the American region, over 70% of homicides are perpetrated with a firearm. In the United States, it's about 70% of homicides are perpetrated with a firearm. And then Middle East and other high-income countries have the highest percentage. But this shows you a sense of the extent to which firearms are involved in homicides across the world. Another very interesting finding is that homicide rates have been declining worldwide. And the decline has been greatest in high-income countries. Homicide rates in high-income countries between 2000 and 2012 have dropped by about a third. They've dropped also in lower middle and upper middle income countries, but not nearly as much. It's very interesting, this pattern in high-income countries. I wonder to what extent the reasons that we see in the United States for the decline in homicide are similar in these other high-income countries. The other thing they did in this global status report, which I think is very important, is that they monitor what countries are doing in terms of intervening to prevent violence. And you can see a whole series of different types of violence prevention strategies that they monitored in these 133 countries, which I should say cover about 82% of the population of the world. What they did was they asked each country to fill out a form and make judgments about the extent to which they had prevention programs of these different types that, that were implemented on a larger scale. And what they meant by larger scale was that if over 30% of the target population for that intervention was reached in that country by the intervention. This is very difficult to do because we're not even sure about some of this in the United States. So these are in large part judgments in the parts of the countries. But I just show you this to give you a sense of the value of this status report. I'm not able to review all the rich information in it, but important to note this. And we'll be able to compare over time the extent to which countries are increasing coverage in terms of scaling up interventions and to whether that's associated with declines in lethal violence and maybe someday non-fatal interpersonal violence. They also monitor different prevention laws. The one law here on this list that is related to means is laws against weapons on school premises. In this case, they found that almost 84% of countries had such laws, but only a little over 50% judged that those laws were fully enforced. So they tried to get the level of enforcement as well as the extent to which if there was a law in the books. Again, some judgment in making these decisions about whether a country had these. They also do look at, although they didn't share this information with me, with laws specifically related to firearms in different countries. So I encourage you to look at this report and see what you can find. Suicide. Suicide, as I said earlier, over 800,000 suicide deaths in the world in 2012. And you can see the highest suicide rates are in Russia and Eastern Europe, as well as India. Surprising to me is the high suicide rates in East Africa. Also, there's some pockets in South America, and I think that is Guyana and who said that? Suriname, yeah, which is surprising to me as well. Some of the facts from this report, that for every suicide completion, there are more than 20 others making an attempt. The suicide is actually the second leading cause of death among 15 to 29-year-olds worldwide. The male-female ratio is lower in low and middle-income countries. In the United States, the male suicide rate is about 4 times higher than the female suicide rate. But when you look at lower-income countries, there's much more similarity in terms of suicide rates between males and females. Pesticides, hanging, and firearms are the most common means of suicide globally. Now, this is important because for 72% of these suicides, they don't know what the methods are. One thing I've been trying to determine is how many suicides are committed with firearms globally. You can't figure it out yet. We'll come back to the data issue. Suicide accounted for 1.4% of all deaths worldwide, making it the 15th overall leading cause of death in 2012. In the United States, about 50% of suicides are committed with a firearm. Suffocation accounts for about 25%. There are some groups in which suffocation is increasing as a means of suicide in the U.S. And poisonings are also very important. We also need to worry about whether the epidemic of prescription drug overdose, to what extent that is associated with suicide in the United States. Globally, these are numbers of suicides, and you can see that 3/4 of these suicide deaths occur in low and middle income countries. For homicide, it's more like 90% of the death of homicides occur in low and middle income countries. And you can see that the great majority of suicide deaths occur among young people. However, if I were to show you the rates of suicide, the highest rates of suicide globally, as in the United States, the rates increase with age. The highest rates are among older people, both globally and in the United States. Here's the trend in suicide in the United States. I wanted to show you this because since 2000, we've had an increasing trend in suicide in the United States. In 2009, suicide surpassed motor vehicle injuries in terms of the number of deaths, which is amazing to me. There are now over 40,000 suicide deaths each year in this country. Among middle-aged males and females, suicide rates since 2000 have increased by about 30%. So this is a very serious problem that is increasing in contrast to the decreases we've witnessed in homicide. Let's talk for a minute about lethality of firearm injuries. If we look at all injuries in the United States, here is the injury pyramid, as we call it. For every death, there's about 16 people who are hospitalized or transferred between hospitals for an injury event. And for every death, there's about 142 people that are treated and released from emergency rooms. Now let's contrast that with firearm-related injuries. We don't have a pyramid anymore. We have a rectangle. For every death due to firearms, there's about 1.2 people hospitalized or transferred between hospitals for firearm injuries, and about one person treated and released from an emergency department. What this means is about the case fatality rate for firearm injuries is about 30%. That's a highly lethal condition. That is on par with some of our most lethal types of disease. Now, to be clear, this lethality varies by the manner of injury. Unintentional injuries are less lethal. About 3% of unintentional injury events, at least if they're serious enough to be treated in an emergency department, are fatal. For firearm assaults, about 16% are fatal. And that's still a high case fatality rate, 16%. But for suicides, about 84% are fatal. So the means matters. It matters a lot for suicide. I also want to thank another great friend in providing me with slides and data, and that's Garen Wintemute. And I would say Garen's just released a paper in the annual review of public health on the epidemiology of firearm violence in the United States. And this should be a background paper for this workshop. It has great information on the nature of this problem in this country, with some comparisons with other countries, and that's what I'm showing you now. If you compare the U.S. in OECD nations, that's the Organization of Economic Cooperation and Development, and these are high-income countries. But you can see here that when you take firearm homicide and firearm suicide together, the rates in the U.S. are about 3 times higher than the next highest country, Finland. And also see that both for firearm homicide and firearm suicide, taken individually, the United States ranks highest among these high-income countries. which is why I want to show you this second slide that I borrowed from Garen. And this is the prevalence of past year assault in these same nations. And what you can see here is that the U.S. ranks 20th out of 22 countries in terms of their rank in terms of past year assault. What this suggests is that the violence that occurs, interpersonal violence that occurs in the United States, is much more lethal than that in these other countries. We are actually not, perhaps you could say, the most violent of these countries, but we are the country in which the violence has the highest degree of lethality. Global need for better data. Both these reports, the World Global Status Report on Violence for WHO and the Suicide Report, point to the need for better data for lethal violence. This is a chart which shows by different regions of the world, again, data that's available and they're able to draw from police and from vital registration systems. And you can see that actually globally, police data are a much more reliable source of data than vital registration for deaths that occurs around the world. Both these data sources are important, and we can gain information from both of them. And there's a great need to improve vital registration data. This is particularly true of suicide, because suicide data can't rely on data from criminal justice agencies. It relies heavily on data from vital registration statistics. And you can see in this map, if you can't read it clearly, it just shows the red spots are those countries which lack very good vital registration data, and that's true in Africa, of course, as well as the various parts of Southeast Asia. But there's a great need to improve data on vital registration, data on deaths around the world. One of the innovations in the United States is the National Violent Death Reporting System. And we are lucky to have a number of people that are pioneers in helping to get this system off the ground over the past decades. Steve Terrett and Garen Wintemute have wrote editorials early on calling for the creation of such a system modeled on FARS, the Fatal Accident Reporting System used by NHTSA, the National Highway Traffic Safety Administration for motor vehicle injuries. And Steve Hargarten and David Hemingway were early pioneers in piloting this system in states around the country. And the unique part of this system, and I should also mention the Joyce Foundation has been a great friend in supporting and helping us to mount and get the system implemented across the country. What the system does is simply doesn't collect new data. It links data from existing data sources, death certificates, core and medical exam reports, and law enforcement reports, and other potential sources. And it takes advantage of circumstantial data that's available, for example, in police reports that's not in vital statistics, and takes advantage of other data that's in vital statistics that's not in police reports to create a much more powerful set of information to guide prevention and response to lethal violence in this country. We're now in 32 states. We just got appropriations from Congress last year, or this year, 2014, to expand from 18 to 32 states. You can see we have a pretty good coverage of the northeast part of the country and have big pockets in the south and the west where we need to improve. But this system is like, I describe it to people as like fine wine. It will get better as it ages, because as we move to electronic data collection, this system will become more efficient. As we move to electronic death certificates, as states are doing now, we'll be pulling information much more efficiently and quickly. As police move to electronic data collection and medical examiners as well, this system will improve in its efficiency and the speed at which it can turn around the information. This might be a model that could be tried in other countries, and we hope that is a possibility someday. Let's talk finally about the prevention of lethal violence. I have a quote here from Bill Foege, former director of CDC, and it really expresses what I'm thinking about this issue. He says, in retrospect, it seems clear, and he's talking about the smallpox epidemic, and he was one of the people that perhaps one of the main people that led the eradication of smallpox in the world. In retrospect, it seems clear we didn't know how to eradicate smallpox when we started, but they started. But this was not a negative. It was a characteristic of all unsolved problems. We are always faced with making sufficient decisions based on insufficient information. If we had waited until all the answers were available, the work on smallpox eradication would never have started. As I said at the beginning, lethal violence, violence in general, is an urgent problem. I believe we're actually in a better position than they were when they started smallpox. We know a lot about how to prevent violence and lethal violence. We need to learn a lot more, of course, but we certainly have enough information to take action. I'm just going to go over a number of strategies. This is not an exhaustive review, but I'm doing it just to give you a sense that we do know some things. All these things aren't perfect answers to the problem. We need more information on what's effective. And we will be talking more, I'm sure, about other approaches. But controlling access to lethal means is a tried and true strategy. Promotion of safe storage of guns and pesticides, for example. Smart guns. Steve Terrett will be talking about that tomorrow. Forbidding gun possession by persons with a criminal history. Changing how and where lethal means are used, for example, the use of metal detectors. Reducing the lethality of the means of violence, such as reducing the magazine size or improvement in medical response. And also preventing the violence that underlies lethal violence. Violence against women, violence against children, assaults, peer violence, addressing the role of alcohol in causing violence, and interrupting violence before it occurs. Each of these is viable strategies. And by the way, none of these strategies interferes with anybody's rights to possess a lethal mechanism or means. Just some examples, some natural experiments that have occurred worldwide that are classics in the area of suicide. One is the detoxification of domestic gas in England and Wales. And what you can see here is that during the period when they were detoxifying gas that's used for cooking and in stoves in that country, that there was a decline in gas poisonings with suicide, and there was a decline in the overall suicide rate associated with that. So there was not a substitution effect. There may have been some substitution, but there was a net gain in reduction of suicide that persisted over time. Another classic example is pesticides. Paraquat in Samoa is a great example, but pesticides are probably the leading means of committing suicide throughout the world. In Samoa, there was, upon the arrival of paraquat, which as a pesticide led to an increase in suicide with pesticide, they introduced controls the availability of paraquat, and lo and behold, the rate of suicide went down associated with the decline in paraquat-related suicides. So again, there didn't seem to be, in the short term, a substitution with other means. Safe storage. We have a lot of information that suggests to us that safe storage is important. And everybody advocates safe storage of firearms. We need more information on what's effective, but this seems like a very viable and important strategy. Smart gun technology. This is the Armitex pistol, which was released for distribution in the United States earlier this year. I don't think is any longer on the means, but Steve Terrett will explain tomorrow how this works. You can only operate the gun if you're wearing the watch. So there's a transponder there, and Steve completely understands the technology underlying that transponder. Here's another one I think is really important. We don't talk about it much. There was a study called Murder in Medicine that was done in 2002 or published in 2002. But what they did was tracked homicide rates in the United States from 1960 to 1999 and assault rates. But the important thing of what I want you to look at is the trend in lethality. And what they found that the lethality of violence was declining. they suggest if the lethality of interpersonal violence was the same in 1999 as it was in 1960, the homicide rate would have been much, much higher. And they attribute this to changes in the medical response to violence. Lessons learned in surgical procedures and how to treat injuries, firearm injuries in particular. The rapidity with which we are able to mount medical response, the organization of trauma systems, these have all contributed, they believe, to a decline in the lethality of violence and hence to homicide. And this may have something to do with the declines we see globally in homicide rates worldwide. Here's just another example of a study that I was involved in with Elizabeth Vigger years ago, and where we demonstrated that state laws restricting convicted batterers' access to guns were effective in reducing intimate partner homicides by around 10%. This study has been replicated in 2 other places since then. So we have, by 2 other researchers since then, so we have convincing evidence, I believe, that this can be an effective strategy. Cure violence, formerly known as ceasefire, is another approach involving the interrupters, actually much more. Daniel Webster, who will be here later, evaluated this in Baltimore and found it to be effective in several communities within Baltimore in reducing homicide rates in those areas and other types of gun-related events. We also know a lot about other means of violence prevention. Our evidence base has increased dramatically over the past 2 decades. And so we are not at a shortage of information and knowledge to take action. As Patrick said, Sunday actually, last Sunday, December 14th, was a 2-year anniversary of Newtown. And I show this because I think we can't forget the faces. Now these children, every time I see this picture, it makes me sick to my stomach. These children are not the typical victims of homicide or of lethal violence in this country. But I think they symbolize how far we've let this go. They symbolize, to me, the urgency of addressing this problem. And I worry that we have forgotten Newtown. I worry that as a society, this has escaped many people's memory far too quickly. Right after Newtown, President Obama said, "Now is the time." That was 2 years ago. I'm sure if he was here, he would say, "Now is still the time." And I hearken back to the urgency of the problem of lethal violence. This problem of violence deserves the same level of urgency that we give to countless other public health problems. And I thank you all for being here to discuss it and figure out ways to address it. Thank you very much.